Hello and welcome to You Are Okay. I'm Lietta and today we are going to explore a topic that affects millions worldwide, depression. It is one of the most complex and misunderstood conditions in psychology, yet it is profoundly relevant to anyone who wants to understand human behavior, emotion, and mental health. Depression is not just feeling sad or having a bad day. It is a multidimensional disorder impacting the brain, the body, behavior, and even relationships. There are many types of depression, each with its own nuances, symptoms, and treatment relevance. Understanding these types is essential not only for clinicians but also for anyone seeking to support themselves or others. We will discuss major depression, dysmia, seasonal affective disorder, postpartum depression, and bipolar depression. We'll explore their symptoms, typical behaviors, underlying mechanisms, and why proper diagnosing is crucial for effective treatment. Depression is more than a mood. It is a complex interplay of neurotransmitters, brain networks, stress hormones, and psychosocial factors. Research by Aaron Beck, for instance, has shown that negative cognitive patterns and distorted thinking reinforce depressive episodes, creating a vicious cycle. Robert Sapolsky highlights the role of cortisol and stress response in both triggering and sustaining depression. Van der Kolk emphasizes that trauma, particularly in early life, can shape depressive patterns. Let's begin with major depressive disorder. This is what most people think of when they hear depression. It is characterized by persistent sadness, loss of interest or pleasure, and significant impairment in daily functioning. People may experience sleep disturbances, appetite changes, low energy, difficulty concentrating, and feeling of worthlessness or guilt. Behaviorally, major depression often manifests a withdrawal from social activities, decreased productivity, and a sense of hopelessness. It is critical to recognize that major depression is not a weakness or laziness. It is a medical condition with identifiable brain changes, including reduced activity in the prefrontal cortex and altered functioning in the amygdala and hippocampus. Dysmia, or persistent depressive disorder, is a chronic lower grade depression. Individuals with dysmia often feel numb or mildly sad for years. Symptoms are less intense than major depression, but persist long enough to disrupt life satisfaction, self-esteem, and relationships. Because it is chronic, people often normalize their emotional state, thinking, "This is just who I am," which delays recognition and treatment. From a behavioral perspective, dysmia leads to a consistent pattern of low motivation, reduced ambition, and avoidance of challenges. Seasonal affective disorder, SAD we'll call it, is a type of depression linked to changes in seasons. We all know this and typically emerging in fall and winter when sunlight decreases. Symptoms include low energy, increased sleep, craving for carbohydrates, and social withdrawal. Neurobiologically, SAD is associated with disruption in circadian rhythms and melatonin regulation. Light therapy has been shown to be highly effective because indirectly influences these biological systems. Behavioral patterns include a tendency to hibernate, reduced engagement in previously enjoyable activities, and a sense of heaviness or lethargy. Postpartum depression affects individual after childbirth, and it's really very sad for somebody who become a mother. Hormonal fluctuations, sleep deprivation, and psychosocial stressors contribute to its onset. Symptoms may include sadness, anxiety, irritability, feelings of inadequacy as a parent, and even difficulty bonding with the newborn. Behavioral manifestations often include withdrawal, avoidance of caregiving tasks, and heightened sensitivity to stress. Recognition is vital as untreated postpartum depression can impact the mother's mental health, infant development, and family dynamics. Bipolar depression is part of bipolar disorder, which involves mood swings between depression and mania or hypomania. During depressive episodes, individuals experience symptoms similar to major depression, but these alternate with periods of elevated mood, energy, or impulsivity. Understanding bipolar depression is particularly relevant because typical antidepressants can sometimes trigger mania or if used without a mood stabilizer. Behaviorally, individuals may struggle with inconsistent productivity, risky decision making during manic phases, and profound withdrawal during depressive phases. Across all these types, certain common features emerge. Depression affects cognition, leading to negative thinking patterns, rumination, and difficulty concentrating. It impacts behavior, reduced motivation, withdrawal, and social disengagement. They are common. Emotionally, it produces a spectrum of experiences from deep sadness to numbness and irritability. Physiologically, sleep and appetite changes, fatigue, and psychosomatic symptoms frequently accompany depression. Understanding this distinction is crucial for treatment. Major depression may respond to combination of antidepressants and cognitive behavioral therapy. Dysmia often benefits from long-term psychotherapy and lifestyle interventions. SAD responds to light therapy and circadian rhythm regulation. Postpartum depression requires supportive network therapy and sometimes medication. Bipolar depression needs careful mood stabilization alongside psychotherapy to manage cycles effectively. Life examples can illuminate these concepts. Imagine a talented young professional who consistently pushes herself at work but has endured chronic low mood since adolescence. She may have dysmia, leading her to undervalue achievements and normalize sadness. Another example is a mother after childbirth who finds herself unable to connect with her baby despite her big love. Postpartum depression explains both the biological and psychosocial mechanism behind her experience. Or consider an artist who feels deeply low during the winter months yet vibrant in summer. Seasonal depression provides clarity. Neuroscience reinforces these insights. Imagine studies show that in depression, the amygdala, responsible for processing emotions, becomes hyperactive, while the prefrontal cortex, responsible for executive control, is underactive. Neurotransmitters like serotonin, dopamine, and norepinephrine are dysregulated, which influences mood, motivation, and reward processing. Stress hormones, particularly cortisol, are often elevated, creating a vicious cycle between environmental stress, biological response, and depressive cognition. Recognizing the type of depression is not only academically important, it is vital for empathy, support, and treatment. Misdiagnosis can lead to ineffective or harmful interventions. A person with bipolar depression, misdiagnosed as major depression, may experience severe consequences if treated with antidepressants alone. A person with SAD may be told to cheer up rather than receive light therapy, delaying relief. Finally, let's emphasize the human dimension. People living with depression, regardless of type, often face self blame, stigma, and feelings of isolation. They may appear functioning while internally struggling, or they may withdraw entirely. Symptoms affect relationship, career, and self esteem. Understanding the specific type of depression helps both professionals and loved ones provide tailored support, validating the experience, offering effective interventions, and fostering hope. In conclusion, depression is not a monolith. It is a spectrum of disorders with overlapping but distinct features. Major depression, dysmia, seasonal affective disorder, postpartum depression, and bipolar depression each have unique symptoms, behaviors, and treatment relevance. Neuroscience, psychology, and clinical experience converge to show us that accurate recognition, compassionate support, and tailored intervention are essential. By understanding the nuances of depression, we not only improve treatment outcomes but also deepen empathy, reduce stigma, and empower individuals to regain control over their emotions, behavior, and life trajectory. Thank you very much for being with me today.